Welcome back to session 2 of this course on understanding and managing anxiety. I'm psychologist Dr. Tracy Moreno. In the last session, we discussed how anxiety manifests itself in our life. In this session, we'll discuss the best ways to manage the symptoms of anxiety. Fear and anxiety can feel very similar in the mind and in the body. In the mind, there are constant thoughts of anything and everything, from to-do lists to the replaying of conversations, harmful self-talk, wondering the what-ifs or the should-haves or the could-haves, pretty much anything that takes us away from the present moment. Because so many thoughts are coming in and out of our mind at any given moment, it can seem like we're not paying attention at times. But it's not for lack of trying. It's because the anxiety doesn't allow us to. We're not capable of it in that moment. This can make us seem forgetful, flaky, or absent-minded, even unreliable at times, which can then cause us to have problems in our relationships or at work. Our body can also hold on to the past and the fear of the future. Anxiety can cause our body muscle contraction, racing heartbeat, high blood pressure, labored breathing, sweating or a change in body temperature, stomach discomfort. Sometimes it can manifest itself in behavioral ways like biting our nails, picking at our cuticles, cracking our knuckles, shaking our leg, or tapping our fingers repeatedly on a table. Of course, there could be other reasons why people do this. It could be from just being nervous or stressed, or it could be due to another mental health disorder like attention deficit hyperactivity disorder, or another anxiety disorder like post-traumatic stress disorder, obsessive compulsive disorder, or a social anxiety. There are really many other possibilities, which is why it's so important that you be properly diagnosed by someone like a psychologist or a psychiatrist who has special training in diagnostics. Because if not properly diagnosed, we could end up being treated for the wrong problem, which could make our symptoms worse. At any rate, with anxiety, it can feel like our mind and body aren't even connected. Even when we're able to be rational and logical in our mind, our body can still act as if it has a mind of its own. Our body continues to feel fear, even when logically we may know there isn't any reason to be fearful. This is why it's so important to unify the two and practice having a strong mind-body connection. This means our mind and body is functioning as one, with both being aware of each other, listening to one another, and reacting congruently. Basically just being on the same page. Having a strong mind, body, and let's add in spirit connection is a great way to manage and decrease symptoms of anxiety. And one of the best ways to strengthen that connection is by practicing yoga. In fact, research shows that yoga is one of the best treatments for PTSD, post-traumatic stress disorder. And PTSD is an anxiety disorder. Yoga is even shown to be better than therapy. Yoga works because it forces us to stay present. If you've ever practiced yoga before, then you know that you can't hold a pose and balance without staying present. It's just not possible. This reminds us to stay present in our everyday life so that we're not stressing about the past or worrying about the future. I also recommend meditation. But as we all know, sitting in silence, trying to keep thoughts out of our mind can sound laughable with anxiety. So don't do it. Do it another way. Disregard anything you think you know about meditation. And do it your way, in a way that works and will fit into your life. I suggest practicing guided meditation instead, at least in the beginning. Guided meditation engages our senses and it engages our mind, so we're less likely to wander with other thoughts. Start with just 3 to 5 minutes a couple days a week. And on days when you have a quieter mind, try it in silence. Just do what you can, without judgment. And remember, anything is better than nothing. And just like anything else, it gets easier the more we practice. Both yoga and meditation incorporate deep breathing techniques, which we can use by itself anywhere at any time. Breathing exercises can quickly counteract the physical effects of anxiety. That labored breathing, racing heart rate, increased blood pressure. Stretching can also counteract the physical symptoms of anxiety, like the muscle contraction. Combining these exercises with a mantra or affirmations to engage our mind helps us redirect those intrusive thoughts. So while doing a breathing technique or the stretching, combine it with something calming that you can say to yourself, like, "We can do this," or "We are safe." Notice I say "we." This encourages that the mind, body, and spirit are one. We are a team working together. I'm going to guide you through a quick and easy breathing exercise. It's one of my favorites and I think the most effective. But remember, any coping skill we use needs to work for you to be truly effective. So figure out a way that you can make things your own. Wherever you are right now should be just fine for this exercise because I want you to be able to do it anywhere. So go ahead and start to breathe deeply and slowly. Breathe in through your nose and out through your mouth. Make your exhale very slow, as if you're breathing through a straw. Close your eyes if you wish, and slow that breath down a little bit more. On your next inhale, fill your lungs with as much air as you can and hold your breath for a count of 4. And as slowly as you can, exhale it out and allow all your muscles to relax into that breath. And when you're done, go ahead and breathe normally. Good. When you're ready, do that 2 more times on your own. Breathe in through your nose, get in as much breath as you can, hold for a count of 4, and breathe out when you're ready. You can breathe normally in between, and try that once more time. Good. If you'd like more guidance on symptom management, I have 2 talks on Insight Timer that can help. One is called Emotional Regulation, and the other is Manage Emotions with Better Coping Skills. Both of those contain guided exercises, and I recommend listening to them in that order. For your therapy homework, I want you to practice strengthening your mind, body, spirit connection by practicing these activities. Try all of them and do at least one every day. I'm talking about the breathing exercises, the stretching, the affirmations or the positive mantras, yoga, and meditation. Figure out which ones help you the most and use it regularly. Use it even when you're not anxious. When we're anxious or experiencing any high stress, we regress back to what we know. It's what we're used to. We need to make sure that what we know is healthy and appropriate coping skills that will work for us. So we need to be practicing these things when we're feeling okay and the anxiety isn't there. This is the end of session 2. In the next session, we'll talk about why we get anxiety and what our body is trying to tell us. In the course classroom, please ask questions and share your journey.